Hi, this is Dr. Thomas Burnett here at Regeneration Pittsburgh, and today we got Super Bowl champion, Pro Bowler, member of the legendary Steel Curtain Defense, Pittsburgh Steelers, Robin Cole. Bob, thanks for being here. Thanks for talking about the procedure.
For sure, Tom. I really appreciate the time and that we've spent over the years, and anything for you, brother.
Gosh, well, I appreciate it still. So let me give you kind of the synopsis of what's going on. So obviously, years of football, years of sports. Almost every single joint is affected to some degree with arthritis, and almost 2 years ago, you noticed the knees are really, really bad, the hips are bad, the shoulders are bad. So literally almost 23 months ago, almost 2 years ago, we did the bone marrow aspiration and follow up with the PRP. So over those times, I know you've been in physical therapy and done some other things, and I know you're into the whole health in general. So can you give me an update on how the knees and the hips have been?
Well, I mean, the knees have been doing fantastic, okay? I've been able to get on the treadmill and move those knees really well, even some light jogging. I can do some light jogging on in the grass or a soft surface. Has been really working out for me, and that's been helping. Also, move the hip joint, okay? The hip joint, boy, lost a lot of space in all my joints have lost a lot of space. In fact, I've had shrinkage. I've gone from 6'2 3/4" to 6 feet tall. So there's a lot of joint space that had been lost over the years.
Still a monster.
Yeah, for sure. And so the procedure really helped me with being able to because of the joints, you know, the pounding or the rubbing, the loss of space. That procedure has really helped me in getting more flexibility, getting more movement. And along with that, I realized that I have to continue on getting that movement and freeing up that space and freeing up that joint, those joints to move a little bit better. And that's been helping me. But I tell you what, the procedure has been fantastic for me. And it's a procedure that I talk to often. I talk to people about it, about receiving that stem cell treatment that I received. And I think for a lot of them, I say, look here, if you have any challenges along the way, it's better to get started. Don't wait till you're 60 years old to get started on this. Okay? If I've known more about this in early years, it's just the procedure just wasn't around the way that we do it today. But if I had known it in early years, around at the age of 50, I would try to get that done. I would really try to get that done a whole lot sooner after football than wait later until it got as bad as mine, because mine is really, really, really bad. Oh, yeah. But with your help and with the help that I've been receiving, and it's a continuation thing for me to just keep my movement, because I like to move, I like to weight lift, I like to be on the treadmill, I like to take care of my body, and after so many years of playing in the National Football League, there's a pay that I'm right now paying for.
Well, you jumped the question already, and you kind of answered that already. I know you refer people here, but would you recommend the same procedure that you had done to somebody with a similar presentation?
Oh, you better believe I would recommend this to a person that's going through what I'm going through, or anybody. I mean, in early years, there was other procedures that were available, but I would tell them to cut through the chase. This would be the first procedure that I would look at. I sure would.
Yeah, thanks again, Rob.
Thank you, Tom.